Cynthia Kimmelman-DeVries and Andrew Barbee will be sharing today's presentation. Ms. Kimmelman-DeVries is the Director of Administrative Services at the Bronx Mental Health Court, one of the Bureau of Justice Assistance's 5 mental health court learning sites. She will be beginning our presentation today with a discussion of different audiences for data analysis and will return after Mr. Barbee's presentation to discuss data-based communications. Mr. Barbee is a Senior Research Associate at the Council of State Government's Justice Center, which he joined after working for the Texas Office of Court Administration. He will be discussing how court teams can approach performance measurement and evaluations. We will conclude with a question and answer section. Today's presentation, I will conduct a brief introduction, and then I will turn it over to Ms. Kimmelman-DeVries to talk about considering the audience. And then Andrew Barbee will talk about performance measures and evaluations, and then Ms. Kimmelman-DeVries will take it over again to talk about database communications. And then, as I mentioned in the beginning, we will have a question and answer session. As we discussed last time, data collection, analysis, and communication can be essential to designing, operating, and sustaining a mental health court program. At the planning phase, data allows stakeholders to select an appropriate target population and identify available resources. In program operations, data allows team members to communicate effectively with each other to identify potential program participants and link them with services. Performance measures and program evaluations based on data collected allows stakeholders to understand whom the program is serving and with what effects. Outside of program operations, data provides the necessary components for the research that develops evidence-based practices. Despite the over 250 mental health courts in operation today, we know surprisingly little about whom these programs are serving and with what outcomes on criminal justice and behavioral health metrics. Today's presentation will, we hope, provide you with tools to not only improve your own program's functions, but also to build the evidence base that will help the field in general understand more about this type of programmatic intervention. Today's learning objectives are all related to this larger goal. The theme today is knowing your audience and knowing yourself. Which data you analyze should be determined by the goals of your program and whom you are going to be communicating that data to. If your program is focused on rearrest rates and has law enforcement as a major stakeholder, then you will likely be focusing on different data analysis and presentation than if your program is focused on reducing jail days. Similarly, you and your teams will be most persuasive by tailoring your presentation to its intended audience. Today's presentation aims to introduce you to considerations in each of these areas. If you're interested in discussing how these considerations would be relevant to your jurisdiction, please feel free to contact Hallie Fader-Tao at the Justice Center, or if you're a JMHCP grantee, your Justice Center TA coordinator. The Justice Center can also make available additional examples of mental health court database communications for those interested. Hallie's contact information will be available at the end of this presentation, and with these goals in mind, I will turn the presentation over to Ms. Kimmelman-DeVries. Thanks, Elizabeth. So in our first webinar on data collection, we reviewed a very large number of variables that can be collected to help support your mental health court. And we loosely grouped these variables into 3 categories: client demographics, like name, date of birth, social security number; administrative data about your program, referrals, assessments, acceptances, rejections; and criminal justice and mental health information about your clients, so prior, current criminal justice history, arrests, hospitalizations, diagnoses. It's an enormous amount of information. Have you and your program thought about what you're going to do with all of this data? And if you're going to tell the story to anyone, is anyone even asking? And if they are, what is most important to tell them? These are really, really hard questions to answer. But before embarking on the path, your main starting point should be this: who are you talking to? Basically, know your audience. Your audience helps drive the type of analysis you'll be doing and how it should be presented. Generally speaking, the variables you present will be similar across the board for each of the parties. However, different stakeholders are going to be interested in different things, or minimally seeing your data in different ways. Funders, for example, might be interested in long-term client outcome data and issues relating to public safety, such as recidivism and community risk, as well as the direct impact your program is having on your community. Your staff, however, might need day-to-day operational feedback about how many assessments are being conducted, the amount of time it takes from referral to placement, where they are in relation to their peers, and other information to help them manage their work, budget their time, and hone their skills. Consultants might be interested in the number of clients that have an Access 1 disorder versus an Access 2 or personality disorder. And your clients might want to know what groups you're offering in the fall, did you offer them last fall, and which staff member is running them. Is there a large attendance, and who comes to the groups, men or women, people who are employed or looking for work, or people that may have similar diagnoses as they do? Now, while your external stakeholders might be interested in very similar information, the way you present this information to them might be much different than how you present it to your staff and funders. From a sustainability perspective, this might be the most important group of people you tell your story to. Your external stakeholders present a wealth of opportunities for self-marketing, building relationships, and strengthening community ties. A policy organization, for example, in your local community might want to see a one-pager program description they can bring with them when meeting with a local government official. Or a local university who's starting a mental health clinic in their hospital might want to know more simple data about your client demographics, age, gender, diagnosis to see if you can partner together. And a national foundation might be interested in more sophisticated data analysis about recidivism or community impact your program has, which would necessitate you engaging an evaluator or PhD-level researcher your program may not have built a relationship with yet. A little planning up front can go a very long way in the end when planning on which data elements you'll capture, how you'll use that data, analyze it, and the best way to present it to internal and external audiences. I'll now turn it over to Andy.
Thank you, Cynthia. It's good to be back with everybody here. Hopefully some of you had the opportunity to interact with us in our previous webinar. This is a very important follow-up to that webinar to help you understand some of the ways of using the data that your courts are probably collecting. In collecting data and trying to make decisions about how you're going to use it, it's important to understand what the various purposes of data analysis might be for your court. There are those types of analysis that help you operate your program on a day-to-day or month-to-month level. These are kinds of analyses that will be done frequently. They typically will be fueled by data that is familiar to everyone who's involved in the program. Then there are those types of information and analyses that will be less frequent but much more in-depth when they are done. Often these are going to be referred to as the more research-oriented types of analyses. And these are where basically you're going to start addressing issues of program effectiveness, where you're looking at data to help you understand the performance of the program, whether or not it's achieving the types of outcomes that are stated in the goals of the program. Once you have a sense of the various types of analysis and the purposes of the analyses, it's important to understand some of the more specific examples of data analysis. Probably the first and most commonly recognized is that of the performance measure. Now, it's important to understand that with respect to these performance measures, they shouldn't be confused with the types of grant funding related performance measures that are, for example, required by the Bureau of Justice Assistance. But similarly, they are tools that are used for management and accountability of the program. Typically, performance measures will be well thought out, planned by a large group of people, and databases need to be designed with the understanding that they should be able to provide the data that are necessary for the performance measures that are chosen for your program. As you move into the types of evaluation that begin to address effectiveness, there are two critical groups of evaluations. Process evaluations essentially address what is known as the fidelity of a program. By fidelity, it means is the program operating as originally intended? For example, are the clientele served by the program the very people that the program is designed to serve? Is the program tracking information that will allow you to do further evaluations? If there is no system in place to capture information related to the program, then you're not going to be able to do the kinds of evaluations that will help you truly address effectiveness. And those are the outcome evaluations. Basically, are your program goals being achieved? As Elizabeth and Cynthia alluded to, there are differences from one program to another in terms of what it is they're trying to accomplish. Some programs may be very focused on reducing the amount of time that clients are spending in the county jails. Others may further try to reduce rates of recidivism and reoffense of their participants. And this is where your outcome evaluations will be handy. Another type of analysis that addresses whether or not essentially the program is worth it is the cost-benefit analysis. In a nutshell, a cost-benefit analysis attempts to establish whether or not the costs of properly operating a program are ultimately offset or exceeded in the reduction in costs to the criminal justice and mental health systems. This is a much more difficult type of analysis, and we will talk more about it in some following slides. This table here should provide a nice, quick summary of the various types of analyses that we're going to be talking about today. You'll see that there are the 4 analyses that we just discussed on the previous page, and we've added some information to give examples of who might perform these analyses, the kinds of expertise that often are required to conduct the analyses, and the types of frequency that you might associate with these analyses. Performance measures typically are measures that should be able to be conducted by members of the program itself, the team members. And while you do not need to have necessarily an extensive background in research methodology, those doing performance measures nonetheless should be able to understand the basics of the data, how it is collected, and how it relates back to the measures they are trying to answer. Performance measures most oftenly are done on a quarterly or semi-annual basis as a result of the fact that they need to be in place in order to help inform the ongoing operations of the program, providing accountability and management capability. With respect to process evaluations, you might be able to have a team member do these. However, oftentimes it is necessary to bring in an outside evaluator. It is definitely necessary when moving into these levels of analysis that you have a requisite level of research expertise. It is important when engaging a process evaluation to know the type of design that should be put in place in order to adequately address what is required within a process evaluation. And typically you will need to wait at least a year, perhaps longer, before you conduct a process evaluation. Any program that is at the beginning of its startup will likely experience some changes, some implementation-related challenges, and it is important to allow the program to work through these and establish its own process before evaluating how things are operating. With respect to outcome evaluations, typically an outside evaluator or a researcher is recommended. A higher level of expertise is needed when conducting an outcome evaluation because you have to have, for example, definite control groups and research groups so that you can make comparisons along a variety of statistical measures. It is those comparisons that will help you understand whether or not the program is achieving the effectiveness as stated in the goals of the program. Generally, an outcome evaluation will not be completed or conducted until the program has been in operation for at least one full term, for example, 1 year, or the full length of time that is possible for a cohort to go through full completion and participation in a program. Finally, with cost-benefit analysis, this is a very difficult type of analysis to do correctly. It involves a lot of statistics, and therefore it is definitely recommended that either an outside evaluator or a very qualified researcher be part of that process. Cost-benefit analyses typically will be most beneficial when you're approaching opportunities to get funding to continue the program or perhaps to make a case to funders, policymakers, that the program indeed makes a difference in the lives of the people that it serves. Oftentimes, performance measurement and evaluation are used to inform the design and the operation of the program. It should be understood that this is going to be done in an iterative fashion. It is ongoing. Oftentimes, planning and implementation are formed and discussed as separate things, but in reality, they are complementary, and one will typically follow the other in an ongoing fashion so that your program can be constantly learning about itself and making changes as necessary as you learn more through these analyses. So let's spend a little bit of time talking a little more in depth about performance measures. There are two basic components of performance measures. There are goals and there are objectives. Goals oftentimes can simply be viewed as the broad, overarching intention of the program. For example, one program may have the goal of increasing public safety by virtue of reducing recidivism among those folks that it serves. Well, in order to reach that goal, it is important to have a well-defined strategy or objective on how you're going to measure the achievement of that goal. An example here is a specific measure that looks at the percent of mentally ill offenders who successfully complete a mental health program who are rearrested within 12 months of exiting the program. Ideally, you will see this percentage decrease over time as the program is implemented and able to reach out to more and more participants. Typically, with performance measures, there are predetermined goals that it is hoped the program will achieve. Oftentimes, the performance measure will look at how close to that goal did you come. So, for example, a starting point in terms of recidivism rates 12 months after exiting a program might be 50%. And the goal or the objective of the performance measure might be to see that drop to 45%. So your performance measure has got to be designed in a way that it can track that information and speak to that goal. You may also have many objectives that in multiple address one single goal. It is not necessarily the case that one goal will only have one objective, although that is possible. The National Center for State Courts is currently working on a project where they will unveil a series of performance measures for mental health courts. It is anticipated that in the fall of 2010, these measures will be made public. The National Center for State Courts is working on this project through the support of the Bureau of Justice Assistance, and the Justice Center sits on the advisory board for this project, which is currently in the process of testing its proposed measures in 4 different sites. With the National Center of State Courts, Dr. Fred Cheeseman and Dr. Nicole Waters are directing the project, and they're looking at proposing roughly a dozen core measures. The core measures will touch on the 7 themes that you see in front of you: participant accountability, social functioning, case processing, collaboration, individualized and appropriate treatment, procedural fairness, aftercare, post-exit transition. While the National Center for State Courts doesn't use the term goal, these 7 themes here are in essence statements about what the goals of a mental health court should be. In addition to the dozen core measures or so that they anticipate unveiling in the fall, there will likely be some supplemental performance measures as well to help address these 7 themes. Moving into the outcome and process evaluations, where you begin the process of looking at the effectiveness of your program. Here are some examples of the types of inquiries related to each of these process and outcome evaluations. Again, a process evaluation is meant to assess whether or not the program is operating as it was originally designed. For example, are the participants being referred to the program showing the types of diagnoses that the program was meant to address? The program may have a certain capacity built into it in terms of the staff working in the court. It is important to determine whether or not the number of referrals to the program are within the capacity constraints of the program. What criteria are used to determine whether or not somebody is admitted into the program? All of these types of things should be addressed in the design of the program, and it is very important to understand whether or not your program is actually addressing those design standards. With respect to the outcome evaluations, you're starting to look more closely at whether or not the effectiveness of the program is materializing. Are the goals being achieved? For example, if it is a program that is meant to increase public safety by reducing recidivism, what is the frequency of rearrest for those completing the program? Programs that are interested in reducing the amount of time spent waiting in a county jail bed need to look at the length of time spent in jail by those who are participating in the program. Other examples include whether or not rates of substance abuse are on the rise or are in decline. Are there reductions in rates of crisis intervention and institutionalization? Now, often the outcome evaluations are what everybody is excited about and most anxious to get to. But it can't be overstated the importance of the process evaluation. In reality, it is the process of how a program is implemented that determines the outcomes that ultimately are achieved. So the process evaluation, while it may not be as exciting, it is every bit as important as the outcome evaluation. How to use process evaluations. We gave some quick examples on the previous slide. For example, are the people who are coming into the program of the type of profile from a diagnosis perspective that the program was meant to serve. But there are other examples of process evaluation. For example, if you know in your mental health court population that 80% of the potential applicants are African American, you need then to look at the actual race breakdown of those who are participating in the program. This pie chart gives an example of a program that is serving only 29% of their population who are Black or African American. This would be a very quick indicator that there is potentially a breakdown in the process of determining who and how a person is referred to the mental health court program. Another example would be the referral source and how good of a job they are doing in referring the right candidates to the program. This example here indicates that the private defense bar has only 20% of their referrals actually being accepted into the program. This would provide a quick indicator to those administering the program that perhaps those within the private defense bar do not correctly understand what the criterion are for being admitted into the program. When moving into outcome evaluations, expense is oftentimes a consideration, especially when you're considering obtaining an outside evaluator or a trained research expert. There are ways you can afford these outcome evaluations when you have to move into that level of assistance. Oftentimes, local universities or centers of excellence will be eager to help a program such as a mental health court to design and implement an outcome evaluation. Groups such as the Brooklyn Mental Health Court and the San Francisco Behavioral Health Court have both done extensive self-evaluations. These web links here can give you insights into the evaluations that those courts have done and help provide guidance on how to reach out to other groups to get information and advice on conducting an evaluation of the outcomes of your program. Again, it is important to understand that when conducting an outcome evaluation, the expertise of the person designing that research design is very important. There have to be control groups and research groups appropriately and clearly defined in order to do these types of evaluations. And typically only somebody with a fairly high level of research expertise will be able to do that properly. I want to end my part of the discussion by talking briefly about cost-benefit analyses. RAND put out a report in 2007 that is held very much as the gold standard of cost-benefit analyses in the behavioral health arena. You'll notice when you look at this report, it is very thick, and there is a lot of information. That in and of itself can be an indicator of the types of technical detail that should be taken into account when doing a cost-benefit analysis. Practically speaking, your costs are going to be things such as staff time and the resources of the program that are devoted to making it run. And you have to be very fair in this and not shortchange the true costs that are required for running the program. The benefits that might be experienced include reductions in jail days, reductions in ER visits, and all of the costs that are associated with that. You have to consider average lengths of stay in jail, per diems, the average cost as a result of going to the ER. And it's in contrasting the costs of running the program with the benefits of avoiding jail days, reduced medical costs, where you'll be able to do a calculation that gives a sense of whether or not the program and the cost of running the program is offset by the benefits by virtue of reductions in costs associated with the criminal justice system and the behavioral health system. Cost-benefit analyses, unfortunately, are one of the more frequently abused analytical techniques. Everybody wants to do a cost-benefit analysis, and all too often they take shortcuts and they don't adequately state the cost of running the program, and they may compound that problem by overstating the benefits. You have to, for example, consider net widening. Net widening is a term that basically means some people will be brought into the system who would not have otherwise been brought into the system. In other words, they are not a true diversion. A very rough example of this that I have heard in some mental health court venues is that somebody might be taken into custody by the police because they know there is a mental health court that might be able to provide this person some services. But for the existence of that mental health court, there's a good chance local law enforcement would never have brought the person into custody due to the seemingly low level of seriousness of the offense for which they arrested them. So items such as these have to be taken into account when doing a cost-benefit analysis so that it is as accurate a portrayal of the benefits of the program as possible. I'll now turn it over to Cynthia.
Thanks, Andy. I'm going to change our perspective a little bit and now talk a little bit more about actual key things that you want to consider when you're drafting and putting together your presentations. So going back to our original question of knowing your audience. So who is your intended audience? Are you going to be presenting to internal staff or to external stakeholders or funders? And how is this group of people used to receiving information? For example, attorneys may be used to receiving memos, while legislators are more likely to be receiving or used to receiving one-page presentations or presentations. And how will you be communicating with this group? Will this be a presentation at a conference, a conversation in an elevator? And what's the goal of your communication? Are you trying to generally inform, or you make a key point about how rearrest is going down? All of these considerations can shape how you approach the communication, from deciding to look for a spot on the local news to presenting at a national conference, or to giving your judge a one-pager to memorize with key program statistics. There are two major categories of documentation: written examples and visual examples, data presented about your program in graphical or table form. And we'll demonstrate examples of these in the following slides. Written examples and documentation are most appropriate when you know your audience is going to spend more time with the information and will have an opportunity to read it in depth. One-page documents highlight elements of your program: key statistics, accomplishments, awards, or staff biographies, for example. They are great takeaways to have available at community meetings, to include as orientation materials for visitors to your program, or to have as handouts at conferences. They're also great as email attachments. It's a simple way to draw attention to key elements of your program in a quick, eye-catching, and effective way to drive short and directed points home to your audience. Reports and lengthier narratives are a great way to inform policy and governmental audiences about the long-term work and community impact your program has been having. In partnership with your evaluator, for example, you can educate legislators about important issues relevant to your population, the challenges they face in the community, barriers to employment, difficulties navigating the entitlements and benefit systems when you're mentally ill, or access to adequate psychiatric and medical care. Talking points are more one-liners or two-liners versus a whole one-pager. Statements that can be used in focus groups with your clients and staff, during roundtable discussions at conferences, icebreakers at stakeholder meetings, and generally a way to start discussions or direct conversations. They include 2 or 3 basic facts that state the problems your program addresses, and 2 or 3 basic facts about how effective you've been. Talking points or otherwise known as, I just bumped into my local city council representative on the elevator and I have 30 seconds to make my pitch. What are you going to say? Or, are you going to let this opportunity pass you by? In contrast, visual examples are best used when you have a fairly large amount of data or numbers to convey to your audience. The next slide is basically an example of a one-pager that the Bronx Mental Health Court program has drafted. Our marketing and fundraising departments rely on it heavily when they're soliciting donations from local businesses and organizations of our community and the surrounding area. They use this as a one-page short and pointed description to accompany mailings to people, telling them who we are, what we do, our successes, and in what smaller areas we can use support and donations. It's listed under the last set of purple bullet points under funding. Directly in the program, we've removed the section on funding and used this as a handout as part of our national learning site visits. We give it to key court personnel that are unfamiliar with who we are and what we do, for example, different judges or attorneys, as well as make it available at different community-based events in our area, health fairs, program orientations, and local marketing that we do with treatment providers, hospitals, and community clinics. The next slide is essentially another type of one-pager that was drafted by the Center for Court Innovation, and it's now used throughout New York. It contains a series of measures describing your program, from referrals and participants to client charges, service utilization to client compliance with the program. It's an excellent tool that can be provided to your staff and key court personnel that are representing you, and judges, for example, so that they're familiar with the overall effectiveness of your court. They are very memorizable kind of stats that can be used as talking points to kick off discussions or oftentimes answer questions that come up in meetings over and over again about your program. Now, regarding talking points and those tailored narratives, the Justice Center can direct you to a variety of examples of written narratives and reports. They also know about jurisdictions that have worked on talking points for different audiences by judges, court coordinators, and other key personnel. A jurisdiction in the West, for example, has shared with the Justice Center a number of self-published quarterly reports that can be used as a reference as well. It's important to consider, once again, your audience when preparing these pieces. Who might be presenting the information to them? Your goal when initiating this contact. The resources you have available to you in preparing the information. So, for example, do you have a marketing department, a graphic designer, or a very talented case manager? And then how frequently you want to update and prepare this information and make it available outside of your program. Ask the Justice Center. They have a number of examples of narratives available. Not only do they have the self-published quarterly reports I mentioned just a second ago, but they also have a video of a mental health court appearing on a local news interview and presentations given to different attorneys. The next three slides are different examples of data, of a table, a bar chart, and a pie chart. It's the same data presented three different ways. This information was taken from a self-evaluation conducted by the Brooklyn Mental Health Court. The slide is a basic table comparing two different groups, eligible and those found ineligible for their program. And you'll see a table like this, and I'm sure people have seen this table countless of other times and have come across it in many other different reports. This slide is essentially the exact same data as the previous slide, but we're presenting it more visually. The exact numbers are de-emphasized, and instead, the use of a bar chart gives us a very quick sense of comparison among ethnicities. You see very quickly that African Americans are the largest group of both eligible and ineligible. The second piece of information, however, is a comparison of eligibility and ineligibility, and is also quickly apparent within each ethnic group. The story this slide actually tells is that African Americans represent not only the most referrals, but also have the highest rates of ineligibility. In contrast, a pie chart is the traditional way to compare proportions within a given population. In this slide, the prevalence of African Americans among referrals is the key message. The viewer is struck by this immediately. The chart does not provide information about the size of the population, that is, 52% of African Americans of a total of 100 or of a total of 10. And we're no longer presenting information about eligibility versus ineligibility. When choosing a graphic, you want to tell your story. Visually, pie charts are very interesting and look pretty and are an excellent tool to show percentages in parts of a whole. However, when using more than 5 slices, it becomes a bit taxing on the audience and smaller percentages become more and more difficult to view. Line and bar charts are powerful to show comparisons of multiple data sets, trends, correlations, and rankings. Bar charts can be recorded to show highest to lowest or lowest to highest. Data is also more easily understood at a simple glance. While tables are a very simple and straightforward way to convey data, a table takes a few extra minutes for your audience to process and review. There are also a lot of ways to get fancy. Keep in mind that a visual communication is often being narrated. Choosing the right visual and the right degree of complexity comes back to what your goal is with the presentation. If you want the audience listening to you, you may want to consider a visual that has a single story that is immediately obvious, such as the pie chart on referrals we just looked at. Once viewers get the story, process the visual, they'll be able to pay attention to what you're saying. If your goal is to give the audience a written record of what you're saying, to minimize note-taking, or because there are important nuances, a more heavy, text-oriented, complicated presentation may be appropriate. So, for example, the story for the slide we're looking at right now is to present data across a number of dimensions, so we chose a table. I know there's a fair amount of complexity in the information I'm trying to communicate, so I have let the slide be pretty text-heavy so that you and those who review the slides later when they are posted online have this information all in one place. I'm going to turn it back over to Elizabeth. Thank you so much, Cynthia, and thank you also to Andy for a great presentation. We've not tackled an easy subject today. Our presenters have opened a range of considerations as you develop strategies for analyzing and communicating data about your mental health court program. Some key principles that we would like to highlight. Identify your audience. Policymakers, team members, and funders will all be interested in different things. Identify the purpose of the analysis. Are you updating the team on how the policies and procedures are working, or are you trying to show funders the impact of your program? Select an appropriate type of analysis based on your goals and available resources. We've raised a lot of potential concerns today, and this is where we recommend that you prioritize. What is the most important analysis to do, given the time and expertise that your jurisdiction has available? And select a communication style that fits your audience, your speaker, and your message. Above all, be honest and be realistic. Not every mental health court program will graduate 100% of its participants who will go on to lead crime-free lives, nor will every analytical effort be published in a peer-reviewed journal. The data you collect, analyze, and communicate is there to give you a better understanding of your programs. We all recognize the tension between striving for perfection in your analysis and the limited resources you have to do it. And we as the Justice Center, will do our best to help. As you can see here, there are a number of written resources to help you think through data collection and how it can inform your mental health court program, including Dr. Stedman's publication on mental health court data collection from the Gain Center. The Justice Center keeps up to date about research on mental health courts, so if you're looking for additional resources, please do let us know. Also, through the support of the Bureau of Justice Assistance and the Health Foundation of Greater Cincinnati, and the assistance of the Supreme Court of Ohio, we're in the process of piloting a data collection tool in 6 mental health courts in Ohio. If you're interested in information about this project, please also let Hallie know. And here is our policy analyst, Hallie Fader-Tao, who unfortunately could not join us today because she is doing her civic duty in the grand jury duty. And her contact information is up there, and she would love to hear from you. So now I would like to open it to questions from the audience for our panelists and presenters today. As you can see, there's 2 places you can ask questions, and I will relay them over the audio line to our presenters. You can either type them in the chat or the Q&A panel. So I'll just hold off until I have some questions coming in. So thanks, everyone. Oh, and just to add, we will be posting the slides, the PowerPoint slides, and the recording to our website www.consensusproject.org. And I can also email out the PowerPoint to all the people who attended the webinar today to make things easier. Andy, we have a question on about which programs you recommend. The question is, what different programs, SPSS, Excel, Access, would you recommend to input data for data collection purposes? Do you find one is better than another?
From the perspective of inputting data, I would recommend probably Access or Excel. Access, with a little bit of time learning how to create a data entry form, can really make it very user-friendly. You can incorporate the ability to limit how answers and information are entered. For example, with mental health diagnoses, I've reviewed some data sets where you'd be amazed how many different ways people can type what is one type of diagnosis, and that can make analyzing the data very, very difficult. So when you use a software package such as Microsoft Access, you can create a fixed list or a drop-down list so that people are pointing and clicking on various diagnosis types or race ethnicities or offense types. And so that really facilitates a type of analysis that will be more efficient, less prone to errors that might be the result of trying to make sense of 10 different ways of coding the same thing. So I would not recommend SPSS or SAS in terms of data entry. Now, in terms of data analysis, I would recommend probably first and foremost SPSS or SAS. They're going to require a higher level of expertise in working with data and analytical software, but they give you a much greater power than Excel or Access in terms of being able to generate cross-tabulations, frequencies, and a whole host of statistical measures.
Great. Thanks, Andy. If I can add one thing, Elizabeth.
Of course.
From the working on the front line in the program and the tools that we actually use, I think that what Andy has said and what I'll echo is very similar. Access is really fantastic. It helps our frontline staff who might be entering information about referrals and other different kinds of program operational stuff into a form or into a database much easier. But on the back end, in terms of administrative stuff, things that I use on a day-to-day basis, and if you had attended the first part of the webinar, I also incorporate Excel into a lot of the data collection pieces that we do that fewer members of our staff have control over. So people who are more familiar with data entry, or my research coordinator, for example, where there's more room for narrative and other things like that. So we do a combination of both of them, if that's at all helpful. And again, echoing Andy, we don't use SAS or SPSS here in terms of entering data. It's really a combination of Access and Excel.
Great. Thanks so much.
We have a question about stakeholders, and it is, what is the best way to convince stakeholders, especially politicians, that outcome measures are only reliable after a significant period of time?
I'll take a stab at that. I think Cynthia may have some comments as well. Policymakers, of course, as we all know, they want to know as soon as possible, is it working? And it can be a task convincing them that everyone needs to wait a little bit to let the program sort of take hold. When we've been faced with that proposition, really what we have to focus on is kind of going back to the design of the program. In other words, refreshing for everybody the target population and what the objectives of the program are, and then providing some quick counts of, if it's 3 months into a program's operation. You can talk about seasonality, you can talk about other things, and just demonstrate through those counts. We anticipate that over the course of a year, 500 people will be served. But if we don't wait that length of time, we may only be able to evaluate 75 or 125 people. And at the risk of getting into discussion of statistical techniques, you really just kind of want to hammer in on the fact that if we have more, we're going to have a greater opportunity not only for the program to get up to speed, but to serve a larger, more randomized population. And by randomized, I mean the longer and the more participants, the more likely you are to touch on the full spectrum of people that you're hoping to serve. And you won't be able to do that if you rush the process. It doesn't mean that's an easy thing for policymakers to digest, but that's really the best way to try and make that argument, is to go back and reframe, restate what the goals and the objectives are of the program, and use that to point out how you won't be able to touch on that full spectrum if you don't give the program enough time to take hold.
I think that what Andy using the words reframing is very important. I think that a lot of, and this is again a conversation that could be in a full other webinar in terms of how you define success. But I think that in terms of reframing and positioning your numbers in a little bit of a different way other than just the ultimate outcome is important. So, for example, right now, today, we are managing 160 clients. Those are not the clients that are in the screening process, and those are not the clients that we are looking for programs. The clients that actively today, 160 of them are not in jail. 160 of them are not on the street and they're not buying drugs. 160 of them are in some kind of community-based treatment program, be it either residential or outpatient, and we are managing their symptoms. They are less of a draw on the correction system, and that's 160 people that aren't in jail. And then there's another 160 people that are being linked to our services. So it's a very different perspective or look at what your outcomes are and how you measure success and how you're working with your program and your individuals, and things that I don't know that everybody is constantly, in terms of the nuances of your program and how it works and the things that you are helping your clients with from a day-to-day basis. I'm not sure that politicians are always paying attention to those pieces, and I think those are important. And things like one-pagers, bringing it back to the data, to illustrate to them of what's happening on a day-to-day basis with real people and real numbers. So I'm always the person that likes to draw things down to an actual tangible, here's an actual number of what we're doing out in the community and in just this one local area.
Oftentimes I'll add one more little comment, Elizabeth. The process evaluation can be used as an opportunity to give policymakers and funders some sense of how the program is operating prior to the point at which you're in a position to actually conduct some outcome evaluations. For example, we know from the research that when people reoffend after being released from prison or jail or participating in a program, that they typically will reoffend sooner rather than later. In other words, if they can make it beyond that first 6 months post-release or that first 12 months post-release without reoffending, odds are really good that they're not going to reoffend. So if you have a 3-month program and then you want to follow up for people completing that program to see whether or not they're reoffending in the first 6 months, well, right then and there you know that you have from day one of the program, from the first person participating, a minimum of 9 months that you'll have to wait before you can even evaluate the very first participant, assuming that they complete that 3-month program. So if you want to get, a variety of people that have gone through the program, you can pretty clearly make the case that you're going to need a minimum of about a year before you can start doing any outcome evaluations. But what you can do, after about 6 months, you've had an opportunity, again, assuming it's a 3-month program, you've had an opportunity for kind of 2 waves to go through the program. You can start doing a process evaluation. Again, process is not speaking to the outcomes or the effectiveness of the program, but it's speaking to whether or not the program is being operated as designed. And a process evaluation oftentimes can give them something to kind of tide them over so that they understand we're going to have to wait a little while to actually look at the outcomes, but I at least have a sense that what they told us they were going to do in terms of how the program was going to be run, they're already addressing that and looking at it and giving us some information, us the policymakers, the funders, that they are indeed implementing things the way that they told us. So a lot of times a process evaluation can be, not only that critical component of understanding outcomes, but it can also give those people who are very thirsty for information something while they're waiting on the time to lapse in order to do the outcome evaluation.
Thanks so much. There's a few questions on the National Center for State Courts upcoming performance measures, and we had a great suggestion to do a webinar, and we will definitely talk to the National Center for State Courts about doing that when they release their performance measures. And there was also a question about whether the performance measures would touch on cost-benefit types of analyses. And all that I can answer to that question is that they are planning to have a set of core measures, but also some supplemental measures that will go more deeply into things that would inform cost-benefit, such as hospital stays and jail days and that type of thing. But I will definitely make sure to relay the message to Hallie about potentially collaborating and doing a webinar with them when they release their performance measures in the fall. And given that it is already almost 3 p.m., and we've answered a lot of the great questions that came in, and as I mentioned earlier, please do follow up with us via email, and Hallie is our best contact for that. And I just wanted to say thank you all for your attendance and participation, and thank you to the Bureau of Justice Assistance for sponsoring the event. And, of course, a big thank you to our presenters, Cynthia and Andy. You guys were great. And I've also mentioned this, a recording of the presentation, and the slides will be available online, www.consensusproject.org. And I will also email all of the attendees today the PowerPoint. And finally, when you leave the event, a brief survey is going to pop up, and we would very much appreciate your feedback. So thank you so much.